My name is Dr. Jennifer Dunn, and I work at Northwest Pediatrics in Wentzville, Missouri. February is Kids ENT Month, and we are going to be talking about one of the most common ear, nose, and throat complaints that we see, ear infections. Ear infections are very common. Many kids have ear infections after they have a simple upper respiratory infection or the common cold. Unfortunately, because of the way that antibiotics have been used over the years, and because so many children are in daycare settings and we see a lot more resistant bacteria these days, a small percentage of kids will have recurring ear infections. Sometimes this means we have to use stronger antibiotics to treat a second or third ear infection, and the concern is that if a child always has fluid behind their ears and has frequent ear infections, it could affect their hearing and therefore their speech or language development. So in some cases, if kids have recurrent ear infections between 3 and 6 in a year, we will refer them to an ear, nose, and throat specialist who sometimes will recommend placement of tubes to help the ears drain and prevent future ear infections. Some ear infections are unavoidable. Kids get colds because they're around other kids, because they don't wash their hands and they don't blow their noses, and so they do pick up cold viruses. Sometimes the cold will turn into an ear infection. If a child has a very stuffy nose, then their natural drainage system in their ears doesn't work, and this can turn into an ear infection. There are some risk factors that make ear infections more likely in some children. One of them is just simple family history. If one or both of the parents had a lot of ear problems, it's more likely that the child will have recurrent ear infections. One thing that is something that the parents can control is cigarette smoke. We know that kids that are exposed to cigarette smoke do have a greater number of upper respiratory infections and a greater chance of developing ear infections. So that's something that parents can actually make a difference in. One of the most common complaints that we see in the office is ear pain. And often parents of younger children will think that their child has an ear infection because they're pulling on their ear. And sometimes this is the case, but usually kids pull on their ears just because they found their ear and it's there, or because of teething, or really no reason at all. So if ever you're concerned that your child has an ear infection, you should have their doctor take a look at them. The things that are most concerning for an ear infection would be a cold that seems to be getting worse, or a cold that suddenly starts to have a fever going along with it, a cough that's getting worse or not better after several days, or decreased appetite, or of course if the child says that their ear hurts. Those are all things that would be concerning for an ear infection. Ear infections are caused by nasal congestion and the inability of the ear to drain from the inside. So getting water in the ears in the bathtub or swimming does not cause ear infections, and waxy buildup in the outside of the ear does not cause ear infections. Sometimes the pediatrician or the ear, nose, and throat doctor may need to clean out the wax in order to see the eardrum and tell if there's an ear infection, but wax does not cause ear infections, and parents should not stick Q-tips or anything else in the ear to try and get the wax out, because that can actually make it worse. Many people ask if ear infections are contagious, especially since they often are associated with a fever. The ear infection itself is not really contagious, but since most ear infections are caused by upper respiratory infections or colds, that part is contagious, and that's why we'll see a lot of kids in a daycare setting kind of seem to pass an ear infection around. Once they don't have a runny nose and a cough, though, the ear infection itself is not really contagious. Again, I'm Dr. Jennifer Dunn at Northwest Pediatrics in Wentzville, Missouri.